It was the fourth nursing symposium attached to IMW, which was really good, really quite well attended from nurses around the UK. There were some interesting abstracts that were presented looking at patients coping with dexamethasone, also coping with different side effects. Something which was quite key that came out as well is they're looking to support the carers a lot more now as well with patients with myeloma. It was a fantastic opening for us because we had Robert Kyle come and speak to us, so that was really quite an honour for all of us, and we were all quite blown away by that. Australia are doing quite a few looking at proms and things, using the quality of life tool, the MyPOS tool itself specifically. The only disappointment I had was with the lack of British abstracts that had come in. We're doing some phenomenal work in the UK, and it would have been really, really nice to have seen some of that work presented. Amyloidosis was quite a hot topic for the nurses as well, saying, you know, it's something that's going undetected a lot more, so we need to be more open, especially on first relapse. You know, when we're diagnosing those patients, just keep our eye out, you know, for different signs and symptoms. But yeah, it was really interesting. It was good. So I would just say to everyone, get your work out there, because we are actually doing a really good job in the UK. The overall sense I'm hearing from everything is there's a lot more, let's listen to what the patients want as well. A patient's voice is becoming much more important. Being here in America, you know, their use of drugs is phenomenal to what we can use. But everybody is saying the same thing. You know, it's not one glove that fits all, you know. You've got to really see what's sat in front of you really and what's specific to them and tailor it to the patient. It's just a shame we can't use everything that people from around the world are using.